Greetings. Human culture is built upon formulation of values that forms the basis of ethical society with honesty, integrity, respect, pursuit of excellence, civic duty, accountability and loyalty also. Since the dawn of civilization, by trial and error, it has become established that a society, and more so its medical profession, is a public-oriented and a noble one. They can survive and thrive only by observance and practice of certain rules of conduct which are guided by the various ethical, moral, legal and societal values of the land. Healthcare features in India a universal healthcare system which is run by a constituent states and territories. The constitution charges every state with raising level of nutrition and the standard of living of its people and improvement in public health among its primary duties. Well, law is an obligation on the part of society which is imposed by the competent authority, and non-compliance of which may lead to punishment, which may be monetary, fine or imprisonment or both of them. In a survey conducted at Mumbai, 8 out of 10 doctors feel that the laws that govern the medical practice in healthcare in India are outdated. And even majority of them feel that there are too many laws of the land and licenses which are required to keep up their practice going. Among 297 doctors across specializations says that there are about 50 different laws that govern the practice of healthcare in India. The study conducted by Medscape India, a non-profit trust of doctors, revealed that there are 78% doctors which feel that the laws of the land which govern medical practice are outdated. Licenses have to be procured by the doctors for running a hospital every year. Well, in this module, I, Dr. Shashikant Sharma, will share with you various laws governing hospitals. Say, for example, laws governing commissioning of hospitals are the laws to ensure that the hospital facilities are created after due process of registration. The facilities created are safe for the people using them, with having at least minimum essential infrastructure for the type and the volume of the workload anticipated, and which is also subject to periodic inspections to ensure compliance. There are other laws pertaining to the governing of the qualification, practice, conduct of professionals, sales and storage of drugs, medication management, management of patients, environmental safety, and the list is endless. A hospital administrator should be aware about all these laws, various regulations, policies, procedures, reports and returns, and should keep them abreast with the latest amendments to be on the safer side of the law and provide quality care to the patients. The earliest civilization known to us is Indus urban culture of 3000 to 2000 BC. The renowned medical historian Henry Surgist believed that the public health facilities of Mohenjo-daro were superior to those of any other community. Since the ancient times, certain duties and responsibilities have been casted on the persons who are adopted this profession. This is exemplified in Charak's and Hippocratic Oath. The written evidence of the state involvement and regulatory function is available from Kautilya's Arthashastra. Kautilya considered famine as a bigger calamity than the pestilence of epidemics, as remedies can be found for those diseases. He believed that the king should order the physician to use medicine to counter epidemics. The earliest known code of laws of health practices were the laws which were formulated around 2000 BC by Hammurabi, the great king of Babylon. The first ever code of medical ethics, called the Hippocratic Oath, was laid down 2500 years ago in the 5th century BC by Hippocrates, the Greek physician. He is remembered till date as the father of Western medicine. The process of establishment of a healthcare system also necessitated creation of a legislative framework for practitioners of medicine. In the earlier rule, the physicians and the surgeon brought by East India Company and after 1857 by the British government needed some discipline and regulations. Lieutenant Colonel D.G. Crawford's A History of Medical Services around 1600 narrates several instances of indiscipline insubordination, malpractice, etc. by the doctors, and the punishments including deportation meted out to them. It also narrates the regulation devised by the East India Company for hospital established by them. In India, Grants Medical College Society in 1880 passed Bombay Medical Act and established a medical council. The draft rule of this act included the appointment of a registrar, a maintenance of a name in the register, and penalty for doing wrong things. The Bombay Presidency enacted Bombay Medical Act in 1912. Medical acts in some other provinces followed soon. The Bengal Medical Act and the Madras Medical Registration Act were enacted in 1914. These provincial acts were immediately followed by the Indian Medical Degrees Act, which was passed by the Indian Legislative Council and which was also approved by the Governor General in 1916. The Medical Council of India, now NMC, a national level statutory body for doctors of modern medicine, was constituted after enactment of Indian Medical Council Act in 1933. The first legal recognition and registration for Indian systems of medicine came when the Bombay Medical Practitioner Acts were passed in 1938. As regards to medical practice, a duly qualified medical professional, that is a doctor, an Indian medical graduate, has a right to seek medical practice, surgery or dentistry by registering himself with the Medical Council of the state, of which he is a resident, which by following a certain procedure as prescribed under the Medical Act of the state. The State Medical Council has the power to warn, to refuse, to register or remove from the name of the doctor who has been sentenced by any court for any non-bailable offence or found guilty of infamous conduct in any professional respect. The State Medical Council also has the power to re-enter the name of the doctor in that register. The Supreme Court has been shown consideration by declaring the fundamental right to life covered within its scope, the right to emergency health care. The landmark judgment that marked this momentous event was that of Permanent Katara versus Union of India in Supreme Court in 1989. In this case, a scooterist severely injured in a road accident was refused admission when taken to nearest hospital on the premise that the hospital was not equipped to handle medical legal cases. The Supreme Court, in its judgment, pronounced that the obligation of medical professional is to provide treatment in cases of emergencies, which overrode the professional freedom to refuse patients. According to right to emergency treatment, the status of fundamental right under Article 21, which is fundamental right to life, the court categorically stated that Article 21 of the Constitution casts an obligation on the state to preserve life. Interestingly, the Supreme Court went on to say that not only the government hospital but also every doctor, whether it is a private or a government hospital, the professional obligation to extend his or her services with due expertise for protecting life is mandatory in every case. Applicability of criminal law and medical profession. The criminal law tries to mold the individual behavior in a socially acceptable manner. It tries to reinforce the rules of the social morality to a greater extent. Criminal law defines certain types of human conduct as offences and prescribes the punishment for them. Remission by doctors in their duties and obligations and lapses by them may give criminal liabilities. The liability of being prosecuted in a criminal court and awarded punishment as per the provision of the law. The criminal law as such operates on a doctor in a somewhat different manner than ordinary persons. This is because it allows the doctor to cause injury to the patient for the purpose of preventing a greater harm. The crucial area of criminal law for a doctor is offences affecting life. These offences are mainly murder, simple hurt or grievous hurt, or miscarriage or abortion. A doctor may be charged for any of these offences in general. However, the criminal law arms the doctor with three formidable defences, namely informed consent, necessity, and good faith. Various criminal liabilities in medical practice related to different sections of Indian Penal Code, the code of CRPC, and different acts like Medical Termination of Pregnancy and PCP and DT Act. Laws governing commissioning of the hospital. These are the laws to ensure that the hospital facilities are created after due process of registration. The facilities created are safe for public using them, having at least the minimum essential infrastructure for the type and the volume of workload anticipated. And these are subject to periodic inspection to ensure compliance. Some of these laws are shown on the slide as Atomic Energy Act, Delhi Lift Rules Act, Indian Electricity Act, Delhi Fire Prevention Acts, and much more. The Clinical Establishment Act, that is the registration and regulation, has been enacted in year 2010 by central government to provide registration and regulation for all the clinical establishments in the country with a view to provide minimum standards of facilities and services provided by them. Approval of the fire department is required for a larger as well as smaller hospital, and it would be the responsibility of the hospital management to prove that the hospital would not cause any harm or loss of life or require it to be procured from the municipal council. Some other acts like Atomic Energy Acts are pertinent with respect to radiotherapy, nuclear medicine and diagnostic radiology department. Lift rules of Delhi and Mumbai specifies specifications for fire and non-fire units. If a hospital store has a LPG cylinder in large quantities for usage of the hospital kitchen or any other hospital purposes, the hospital must have a permit from the controller of explosive under the Petroleum Act of 1934. Pharmacy registration for medical shops comes under Office of Drug Controller. There are different licenses for medical shops attached to different hospitals, standalone medical shops. There are different licenses. There is a minimum requirement for registration, like minimum size of the shop should be around 250 to 300 feet, as well as the requirement for air conditioning and refrigeration are also specified. The license for the same is valid for the period of 5 years. Other things like trademark registration, vehicle registration, and if arms are possessed by the hospital, say for example security guards, a license of the same should be available under Arms Act of 1959. Information which should be displayed at the hospital are certificate of registration from the municipal authorities, IMC, registration, charges for consultation, as well as any other procedures, and clinical timing and close days also should be mentioned in the hospital entrance. FSSAI license comes under the Food Safety and Standards Authority of India under Ministry of Health and Family Welfare. This license is necessary if the hospital runs an in-house kitchen for the patients as well as attendants. Qualification and practice and conduct of professionals are regulated to ensure that the staff employed in the hospital for delivery of healthcare are qualified and authorized to perform certain specified technical jobs within a specific limits of competence and in accordance with the standard codes of conduct and ethics. That means the adequate amount of privileging and credentialing should be verifiable from the registering council, and in case of any professional misconduct, the councils can take appropriate actions against them. Some of the laws governing are shown on this slide. The National Medical Commission is an act to provide medical education system that improves access to quality, that provides affordable medical education, and also ensures availability of adequate, high-quality medical practitioner in all the healthcare establishments throughout the country. The Indian Medical Council Professional Conduct and Etiquettes and Ethics Regulations delineates 1. Code of Medical Ethics, 2. Duties of physician to patients, 3. Duties of physician in consultation, 4. Responsibilities of physician to each other, professional courtesy, 5. Duties of physicians to public and paramedical profession, and also specifies unethical acts and misconducts in case of Indian medical graduate. Sale, storage and drugs and safe medication are laws to control the usage of drugs, chemicals, even blood and blood products. They also prevent the misuse of dangerous drugs. It regulates the sale of drugs through licenses. They prevent adulteration of drugs and provide punitive action against the offenders. Blood bank also comes under laws governing sale, storage and safe medication. Well, the term drug is defined in the Act includes a wide variety of substances, which include diagnostics and medical devices too. The Act defines cosmetic as any other product that is meant to be applied to the human body for the purpose of beautifying or cleansing. The government is working on to bringing a new law to regulate medicines, cosmetics, medical devices in keeping with the changes in pharmaceutical market, making the existing law inadequate to monitor the new retail avenues and regulatory demands that has emerged in the recent years. Blood transfusion services in India are regulated by Drugs and Cosmetic Acts 1940 and its subsequent amendments. Regulatory affairs in the Indian blood banking systems are controlled by the Central and Provincial Drug Control Authority, which is under Drug Controller General of India. A proposed new law is likely to replace the Drugs and Cosmetic Acts 1940 and will comprehensively address areas like medical devices, hospital equipments, e-pharmacy, emergency use authorization, as well as and compensation norms in case of clinical trials, etc. The Health Ministry has constituted a member to examine the existing law and propose a draft for the new law by November 30, 2021. Laws regards to management of patients are the laws for setting standards and norms for the conduct of medical professionals. They also regulate and prohibit performance of certain procedures, prevention of unfair practices, and control of public health problems and epidemic diseases. They deal with emergency management of patients, medical legal cases, and all the other aspects related to dying declaration, conduct of autopsy, and various other cases of professional negligence. Some of these laws are Birth and Death Registration Act, Drugs and Magic Remedies Act, Guardian Laws, Lunacy Act, Law of Contract Section, and much more. The Government of India enacted the Transplantation of Human Organ Act in 2011 that allows swapping up of organs and widens the donor pool by including grandparents and grandchildren in the list also. A creation of national human organs and tissue removal and storage network at one or more places, and there constitutes a regional network, provides a system to regulate the removal, storage, and transplantation of human organs for therapeutic purposes, and also prevents the commercialization dealings in all the human organs. Similarly, PCP and TT Act is to provide for prohibition of sex selection before and after conception, and for the regulation of prenatal diagnostic techniques for the purpose of detecting genetic abnormalities, maybe to find out metabolic disorders or chromosomal abnormalities for certain diseases. They also are helpful in finding out sex-linked disorder and for prevention of their misuse for sex determination, which may lead to female feticide. The MTP Act of 1971 provides the legal framework for making termination services available in India. When the pregnancy is caused due to failure of contraception used by a married woman or her husband, and the pregnancy is presumed to constitute grave injury to the mental health of the woman, the bill allows the abortion by advice of one doctor up to 20 weeks and up to 2 doctors in case of certain categories of women between 20 to 24 weeks. The bill set up state-level medical boards to decide if a pregnancy can be terminated after 24 weeks in case of substantial fetal abnormalities. Of late, environmental safety has its concern in a hospital, and biomedical waste management, environmental protection, NOC from Pollution Control Board, noise control, public health bylaws are important laws as far as environmental safety in hospital is concerned. Laws governing employment and management of manpower. 50% of the salaries constitute the budget of the hospital. Contractual outsourcing doesn't absolve a responsibility. This group of laws deals with the laws regulating the employment of manpower, their salaries, their benefits, service rules, and provides a system of redressal of grievances and disputes. Some of these laws are shown on this slide. Mind you, India has 4,000 pages of labor laws. Laws governing to medical legal aspects are the laws governing the doctor-patient relationships, the legal consequences of breach of contract, the medical legal aspects of negligence of duty. Some of these are mentioned in the slide shown. Consumer Protection Act 1986 enables the ordinary consumer to secure less expensive and often speedy redressal of their grievances. This act mandates establishment of a consumer protection council at the center as well as each state and each district also with a view to promote consumer awareness. Hospital services are under Consumer Protection Act. As regards to safety of patients and public within the hospital premises, these laws deal with the safety and services against any accident hazards that may endanger the lives of the management. Radiation protection procedures, radiation protection rules, AERB safety codes, Arms Act, Boilers Act, Gas Cylinder Act, Insecticide Act, and various sections of IPC. Most of the medical colleges have attached hospitals, or attached hospitals have medical colleges. These are the laws meant to govern or regulate the standards of professional education and training of doctors, nurses, technicians, and controlling research activities. These refer to NMC rules for MBBS postgraduate internship, DNB training, ICMR rules, NCI rules, DCI rules, Pharmacy Council rules, and ethical guidelines for biomedical research on human subjects. Business is an important element of any hospital. Some rules govern applicable to hospitals in relation to its business are listed on the screen. In our country, Companies Act 1956 primarily regulates the formation, the financing, the functioning, and winding up of companies. The Act prescribes regulatory mechanisms regarding all the relevant aspects, including various organizational factors, various financial factors, and the various managerial aspects of the companies. There are certain licenses and permits required to open a hospital in India. Very important, a hospital administrator should be aware about the licenses that are essentially required and to renew them as and when required. A hospital isn't a simple building with physicians, nurses, medical devices, operation theatre, ICUs, walls, but it requires a legal obligation while installing this system. Thus, doctors planning to open a hospital should also follow legal protocols and register their business via dedicated platforms. Some of these licenses or certifications require one-time grant and some are renewed annually and some may take 2 to 5 years to get renewed. To conclude, policy in healthcare is vitally important as it sets a general plan of action and is used to guide the desired outcomes. It is a fundamental guideline to help make decisions. The purpose of healthcare policy and the various procedures is to communicate to the employees the desired outcome of the organization. Central and state regulations aim to address several healthcare system objectives. They promote quality of healthcare services, they reduce healthcare costs, they promote access to care, they protect consumers in the market for healthcare insurance and other coverages. The health legislation are very few as compared to the size and the problem in the healthcare sector. There is a need for having a comprehensive healthcare act framed in order to gear the entire healthcare sector to the laid down objectives. Most of the common medical legal situations arise out of non-compliance with these rules and regulations. If a hospital or a doctor acquaints well with these rules and regulations and follow them sincerely, I am sure he or she would be on the right side of the law.